Hello everyone, in this video we'll discuss about foramina of the skull and structures passing through them. Now let's just first see the foramina along the norma frontalis. So from above downward, first comes the supraorbital notch or supraorbital foramen. It will allow passage of supraorbital nerve and vessels. Next to it there are orbits or bony orbits, and within the orbit you will see superior and inferior orbital fissure, and in the roof of the orbit there is optic canal. Now let's just see a diagram to understand structures passing through superior orbital fissure and optic canal. So here in this diagram it is showing right superior orbital fissure which is retort in shape, and the tendinous ring of Zinn which is attached to lower margin of it will divide the fissure into lateral, intermediate and medial compartment. So from lateral compartment, lacrimal nerve, frontal nerve and trochlear nerve will pass. Apart from that, it will also allow passage of recurrent meningeal branch of lacrimal artery and superior ophthalmic vein. From the middle compartment or intermediate compartment, it will allow passage of upper and lower divisions of oculomotor nerve, nasociliary nerve and abducent nerve. And from the medial compartment, the inferior ophthalmic vein will pass. The tendinous ring of Zinn will also enclose the optic canal, and the optic canal itself will allow passage of optic nerve and ophthalmic artery along with the meninges. So this is regarding structures passing through supraorbital fissure and optic canal. Now in continuation to supraorbital fissure, from its medial end you can see over here there is another gap. This is inferior orbital fissure which is situated at the junction of lateral wall and floor of the bony orbit. Now it will allow passage of infraorbital nerve and vessels, zygomatic nerve, orbital branch of pterygopalatine ganglion which is situated just behind to it, and the fourth structure is a communication between inferior ophthalmic vein and pterygoid venous plexus. Now this is infratemporal fossa. Here is a territory of infratemporal fossa, so here will be pterygoid venous plexus, and from infratemporal fossa also you can see this inferior orbital fissure. So obviously a communicating branch passes through this inferior orbital fissure, and that will communicate pterygoid venous plexus behind to the inferior ophthalmic vein in front in the orbit. Apart from that, you can also see nasolacrimal canal. Over here you can see, and that will allow passage of nasolacrimal duct which will open into the inferior meatus of the nose. See over here you can see the probe. Now below to the inferior orbital margin you can see the infraorbital foramen. Just see this. These are found within the maxilla, and they will allow passage of infraorbital nerve and vessels. Basically there is a continuation from infraorbital groove to the infraorbital canal within the roof of maxillary air sinus, and the same will come out as infraorbital foramen, so which will allow passage of infraorbital nerve and vessels. Now in zygomatic bone you can see over here one or two zygomaticofacial foramina are found which will allow passage of zygomaticofacial nerve which is a branch of zygomatic nerve. And if we add upon mandible, so between two premolar you can see mental foramina, and this will allow passage of mental nerve and vessels. So these many foramina are found in norma frontalis. Now let's see foramina along the norma verticalis. So this is vault of the skull, this is coronal suture, this is saddle suture, so here will be bregma, and if you see from behind, these two are part of lambdoid suture. So this is lambda, and 3.5 cm in front of the lambda on either side of the saddle suture. On one side or both the side there may be parietal foramina, so they are absent over here, but somewhere over here they can be seen, and they will allow passage of emissary vein and meningeal branch of occipital artery. The emissary vein will communicate the veins of scalp to the superior saddle sinus which is situated deep inside. Now foramina along the norma lateralis. So this is body of maxilla, this is lateral pterygoid plate, and this gap is pterygomaxillary fissure which will allow passage of third part of maxillary artery, maxillary nerve, posterior superior alveolar vessels, posterior superior alveolar nerves and pterygoid venous plexus. Now this is tympanic plate and this is mandibular fossa. So this portion belongs to squamous temporal bone. This is tympanic plate. So in between these two is squamotympanic fissure. See this? and this is the bony spicule or downturn edge of tegmen tympani, which is coming from petrous temporal bone, and this will divide the initial squamotympanic fissure into petrosquamous and petrotympanic fissure. So here is a petrotympanic fissure, and its medial end will allow passage of cauda tympani nerve, anterior ligament of malleus, and anterior tympanic branch of maxillary artery. So these three structures will pass through this medial end of petrotympanic fissure. Now this is mastered process and this is broken styloid process. So in between these two is stylomastered foramen, and it will allow passage of facial nerve and stylomastered artery. So stylomastered artery will enter inside and facial nerve will emerge out of it. Now between mastered process and tympanic plate, this is the tympanomastered fissure, and it will allow passage of auricular branch of vagus nerve or Alderman's nerve. Now foramina along the norma occipitalis. So here you can see this is part of mastered process. This is occipital bone and this is occipitomastoid suture, and along this suture you can see mastered foramen. Over here also it is seen. Now this will allow passage of emissary vein and meningeal branch of occipital artery. This foramen opens inside into the sigmoid sulcus. See this is sigmoid sulcus lodging sigmoid sinus, and here is the internal opening of this mastered foramen. So the emissary vein will communicate sigmoid sinus in front to the posterior auricular vein behind. So these are the mastered foramina. Now foramina along the norma basalis. So we'll discuss from before backward. First comes the incisive fossa, and within its wall there are incisive foramina which will communicate oral cavity below to the nasal cavity above, and this will allow passage of terminal part of greater palatine vessels, and they will enter from oral cavity to the nasal cavity and nasopalatine nerve from nasal cavity to the oral cavity. Now posterolaterally, medial to the third molar, you can see there are greater palatine foramen, see over here on either side, and they will allow passage of greater palatine vessels and anterior palatine nerve. Posterior to that, within the pyramidal process of palatine bone, there are 3, 2 or 1 lesser palatine foramina, and they will allow passage of middle and posterior palatine nerve. Now this is humor and this is medial pterygoid plate. These are the diverging ala of humor, and here will be the vaginal process of medial pterygoid plate. So between ala of humor and vaginal process of medial pterygoid plate, there forms vomerovaginal canal which will allow passage of branches of pharyngeal vessels and nerve. Similarly, between this vaginal process of medial pterygoid plate and sphenoidal process of palatine bone deep inside, there forms another canal which is termed as palatino-vaginal canal, which will allow passage of pharyngeal branch of pterygopalatine ganglion and a small pharyngeal branch of maxillary artery. For detailed description of palatino-vaginal canal, you can see a separate video. Now posterolateral to that, over here you can see within greater wing of sphenoid, there is oval shaped foramen. This is foramen ovale, which will allow passage of 4 structures, and they are remembered with a mnemonic of MALE. M stands for mandibular nerve, A stands for accessory meningeal artery, L stands for lesser petrosal nerve, and E stands for emissary vein. Posterolateral to that, there is another foramen, and walls of it are having bony spicules, so as it is termed as foramen spinosum. And again, you can remember another mnemonic 3M for the structures passing through it. The first M stands for middle meningeal artery, second M stands for meningeal branch of mandibular nerve, or it is also termed as nervus spinosus, and third M stands for middle meningeal vein. Sometimes between scaphoid fossa, this is scaphoid fossa, and foramen ovale, there is presence of a small foramina, and that is then termed as emissary sphenoidal foramen or foramen of Vesalius. It will allow passage of emissary vein which will communicate cavernous sinus deep inside to the pterygoid venous plexus over here. Similarly, sometimes between foramen ovale and foramen spinosum, somewhere over here there is another foramen, and that is termed as canaliculus innominatus. Whenever it is present, it will allow passage of lesser petrosal nerve. So when the canaliculus innominatus is present, instead of foramen ovale, the lesser petrosal nerve passes through it. Now medial to that, this is a groove. This is termed as sulcus tubae, and it provides attachment to cartilaginous part of auditory tube. But deep inside this sulcus tubae, is in continuation with bony part of the auditory tube, and that opens into the middle ear cavity. Now medial to that, over here you can see this is the foramen lacerum. As its margins are lacerated, generally it is filled with cartilage and no important structure passes through it except the meningeal branch of ascending pharyngeal artery and emissary vein. Now in upper part of it, the carotid canal opens and the internal carotid artery along with the sympathetic plexus enters into the cavernous sinus. Over here you can see. So in upper part there runs the internal carotid artery with nervous plexus, and it is also allowing passage of greater petrosal nerve and deep petrosal nerve. Together they join to form Vidian's nerve or nerve to pterygoid canal. So in its anterior wall there is pterygoid canal. Let me show you in separate bone. So this is temporal bone and this is sphenoid, and over here you can see this is petrous temporal bone, this is body of sphenoid, this is greater wing of sphenoid. Somewhere over here there is formation of foramen lacerum, the walls are lacerated, and as we have discussed, in its upper part there opens carotid canal. So just see the temporal bone, petrous temporal bone, you can clearly see the carotid canal opens over here, so that will allow passage of internal carotid artery with nerve plexus around to it, and that will then enter into the cavernous sinus, which is situated somewhere over here. Now in its anterior wall, the foramen lacerum shows pterygoid canal, you can see over here. Now this pterygoid canal opens in front to the pterygopalatine fossa. Okay, now this will allow passage of nerve to pterygoid canal, and which is formed by fusion of greater petrosal nerve with deep petrosal nerve. You can clearly see the pterygoid canal over here. Okay, so the nerve to pterygoid canal or Vidian's nerve will open over here into the pterygopalatine fossa. This is the territory of pterygopalatine fossa. Now within the petrous temporal bone, this is the carotid canal, and as the name itself is suggestive of, it will allow passage of internal carotid artery with nerve plexus around it, and then the artery runs within the petrous temporal bone. So that portion of artery is termed as petrous part of the internal carotid artery, and then as we have discussed, it will emerge out from the apex of petrous temporal bone, and that is seen partially into the foramen lacerum. So this is carotid canal. Now lateral to that, over here this is mandibular fossa, and this is part of squamous temporal bone, and this is tympanic plate, and in between these two there is formation of squamotympanic fissure, which will then divided by this tegmen tympani into petrosquamous and petrotympanic fissure, and that we already discussed in norma lateralis. Similarly over here this is the mastered process, and somewhere over here will be the styloid process, which is broken. So this is the stylomastered foramen again that we have already discussed. Now medial to this stylomastered foramen, over here you can see this is jugular foramen, and from its anterior part it will allow passage of inferior petrosal sinus and meningeal branch of ascending pharyngeal artery. From its middle part there passes 9th, 10th and 11th cranial nerves, and from its posterior part it will allow passage of internal jugular vein and meningeal branch of occipital artery. So in anterior part there are vessels, in posterior part there are vessels, and in the middle part there are nerves. Now these are occipital condyles, and anterosuperior to occipital condyle you can see a hypoglossal canal or anterior condylar canal, which will allow passage of hypoglossal nerve, meningeal branch of hypoglossal nerve, meningeal branch of ascending pharyngeal artery and an emissary vein. Similarly, behind to the occipital condyle sometimes there are presence of posterior condylar canals, you can see over here, and this will allow passage of emissary vein, which will communicate sigmoid sinus deep inside to the suboccipital venous plexus. Now this is foramen magnum. It has got narrow anterior part and wider posterior part. So from narrow anterior part it will allow passage of apical ligament of Dance, membrana tectoria and vertical limb of cruciate ligament, whereas from posterior wider part the medulla oblongata will continue as spinal cord. Sometimes the tonsils of cerebellum may project through it, and also the meninges will pass through it. So the subarachnoid space of cranial cavity will continue as subarachnoid space of vertebral canal, and within the subarachnoid space it will allow passage of spinal accessory nerve, vertebral arteries, sympathetic plexus around the vertebral arteries, anterior and posterior spinal arteries. So these many structures will pass through foramen magnum. Next is interior of the cranium. So from before backward, first foramen comes is foramen cecum, and this is generally blind, but whenever it is patent, it will allow passage of a vein, and that will communicate nasal mucosa below to the superior sagittal sinus above. Now behind to that, these are the foramina found within the cribriform plate of ethmoid. They are generally 15 to 20 in number, and they will allow passage of olfactory nerves, which will communicate the olfactory mucosa of the nose to the olfactory bulb, which are lying on either side of the crista galli. Now, in the orbit, there are anterior and posterior ethmoidal foramina, and they are also found on other side of the cribriform plate at their junction with the orbital plate of frontal bone. So over here will be anterior ethmoidal canal, and over here will be posterior ethmoidal canal. Both these will allow passage of anterior and posterior ethmoidal nerves and vessels respectively. Similarly, you can see on either side of crista galli there are two large foramina. These are anterior ethmoidal foramina, and from the extradural space, the anterior ethmoidal nerve and vessels will traverse to this foramina, and they will end up into the nasal cavity. So this anterior ethmoidal foramina on either side of crista galli will allow passage of anterior ethmoidal nerve and vessels. Posterior to that, these are optic canals, which will allow passage of optic nerve, ophthalmic artery along with the meninges, and that we already discussed. Now this is lesser wing and this is greater wing. So in between is the superior orbital fissure, see this, and that also we have discussed. See this here also from orbit the same thing is seen. So the tendinous ring of Zinn divides this superior orbital fissure into three compartments, and we already discussed the structures passing through it. Now below to that there is a circular foramen, and so as the name given to it is foramen rotundum, and in front it opens into the pterygopalatine fossa. Just see the probe. Okay. Now this will allow passage of maxillary nerve, which enters into pterygopalatine fossa from this middle cranial fossa. Now posterolateral to that, this is foramen ovale, this one is foramen spinosum, and medial to that is the foramen lacerum. Now these three foramina we already discussed. Next is the petrous temporal bone, its anterior surface, and over here we'll get two hiatuses. One is for greater petrosal nerve, that is continue as a groove, and that goes towards the foramen lacerum. So obviously the hiatus for greater petrosal nerve will allow passage of greater petrosal nerve, which is a branch of facial nerve from middle ear cavity, and this greater petrosal nerve then when reaches to the foramen lacerum will join with deep petrosal nerve to form nerve to pterygoid canal that we already discussed. Now lateral to the hiatus for greater petrosal nerve, here somewhere will be a faint hiatus and a groove, that is hiatus for lesser petrosal nerve, and that goes towards foramen ovale. Now as the name is suggestive of, it will allow passage of lesser petrosal nerve, and that will reach towards the foramen ovale, and finally it enters into the infratemporal fossa. Now both these hiatuses can be clearly seen in separate temporal bone. So this is left temporal bone and this is petrous temporal. So in the front of petrous temporal bone, if we see it from in front, you can clearly make out these two hiatuses. This medial one is the hiatus for greater petrosal nerve, and this one is hiatus for lesser petrosal nerve. So this medial one will continue as a groove, and that will reach towards foramen lacerum, which will be somewhere over here. Similarly, this hiatus for lesser petrosal nerve will continue as another groove, and that will reach towards foramen ovale. Next to that, in posterior cranial fossa, along the posterior surface of petrous temporal bone, this is internal acoustic meatus, which will allow passage of 7th and 8th cranial nerve plus labyrinthine vessels. Now below to that, this is jugular foramen, that also we have discussed. Now this is foramen magnum, and along its anterior side in relation to the occipital condyles, these are anterior condylar canal or hypoglossal canal, that also we have discussed. Additionally, if we see separate temporal bone, this is the posterior aspect of the petrous temporal bone, and lateral to the internal acoustic meatus you can see a slit. Now this is the orifice for aqueduct of vestibule, and underneath the dura the saccus endolymphaticus protrudes through it. along with it, it also allows passage of a small artery and a vein. Now, inferior surface of petrous temporal bone contains three canaliculi. So this is jugular fossa, this is carotid canal, and in between these two, the bony plate shows a small opening. You can see over here. This is tympanic canaliculus. It allows passage of tympanic branch of glossopharyngeal nerve, which will enter inside the middle ear cavity, and along with the other nerves at promontory, it will form tympanic plexus. Now, just in front of this carotid canal, there is a notch. You can clearly see. Now, this notch lodges inferior ganglion of glossopharyngeal nerve. Okay, see this notch, and within the notch, deep to it, you can see a depression, and this is the opening of cochlear canaliculus, which will allow passage of aqueduct of cochlea and small cochlear blood vessels. Now, this is jugular fossa, and along its lateral wall, somewhere over here, there is an opening of mastoid canaliculus. This will allow passage of auricular branch of vagus, and the same nerve will emerge out between tympano-mastoid fissure over here, that already we have discussed, and that is also termed as Alderman's nerve. So the mastoid canaliculus will allow passage of auricular branch of vagus, the cochlear canaliculus will allow passage of aqueduct of cochlea, and tympanic canaliculus will allow passage of tympanic branch of glossopharyngeal nerve. And lastly, along the medial surface of ramus of mandible, this is mandibular foramen. It allows passage of inferior alveolar nerve and vessels. Now, this mandibular foramen leads to a bony canal within the body, and that opens into the exterior of the body in the form of mental foramen. So this is a quick revision of skull foramina and structures passing through them. Hope you have understood well. Thanks for watching.